Hi, Marilyn. Hi, Julia.
Hi, Natalie.
Hello, Natalie. This is wonderful. Joan, Ross, you should be proud. 82 and still counting.
I should just say one thing, Joan. Could you just explain to everyone when you start? Ross is chairing the Clinton Town Hall at the same time, like at this moment, so that people understand why he's not here in Kingston. We divvied it up. Okay, I'll be back.
Good point. I might not have said that actually.
I just thought of it myself.
I know, it's good.
Hi, Dan. Okay, good. Look at all these friends. Okay, see you in a minute.
Yeah.
Hello, Michael Hurley. Nice to see you.
Hey, Julia. Nice to see you too.
So we're going to start probably around, in 2 minutes, 3 minutes. I know we have Ted Hsu, our MPP here, but I know he has to go. So good that you're here now. You're still like having to go, right, Ted? I don't want to be pushing you.
No, I have a meeting nurses. So it's still health. It's health evening tonight.
No, I know. I'm just going to point out that, that you mean to be here. Just pointing out if you leave, it's not because you don't want to be here. So we'll start in, how many are here? In about a minute. How about it? 7:04 and we'll get started.
Yeah, we now have 100.
Excellent. Of course, right now, I just a minute, please. Okay. Wow, it's great that you're all here. Thank you so very much for coming. I'm Joan Jardin, and I'm the co-chair of the Kingston Health Coalition, and I will be moderating this event. As you know, this event will be recorded. Just to point out that the other co-chair, Ross Sutherland, is in high demand, and he wanted to be here, but he's actually at another town hall in Clinton. And so he sends his regret here, but he's doing good work for the Health Coalition elsewhere. We're going to begin the town hall by acknowledging that we are meeting on Aboriginal land that has been inhabited by Indigenous peoples from the beginning. I'm speaking to you from the traditional territory of the Anishinaabe and Haudenosaunee people. As settlers, we're grateful for the opportunity to meet here, and we thank all of the generations of people who have taken care of the land, this land, for thousands of years. Excuse me. We also recognize the contributions of Métis, Inuit, and other Indigenous peoples. The contributions that the Métis, Inuit, and other Indigenous peoples have made, both in shaping and strengthening this community. This recognition must be connected to our collective commitment to make the promise of truth and reconciliation real in our communities. So the plan for this town hall is hosted by the Kingston Health Coalition and coordinated by the Ontario Health Coalition. I'm going to continue doing a few housekeeping and a bit of a welcome. We will have 4 speakers: Bernie Robinson, Michael Hurley, Drew Cumpson, and Natalie Mera. We'll talk a little bit about the local situation, have questions and discussion, and hopefully have actions when we'll leave here. Excuse me. So a bit of housekeeping. Please mute yourself if you aren't already. And so that's at the bottom corner, left-hand corner of the screen. If there's a red line through it, then of course you're muted. And it's really helpful if you can stay muted, because as soon as you get unmuted, you know, your dog's going to bark or something, and it'll make it hard for people to hear. In my case, it's usually my husband getting ice from the ice machine. It's very loud. So if you can please make sure you're muted, please. In addition, after the all the speakers have made their presentation, there will be time for questions and strategy action plan, and everyone is welcome, in fact, invited to participate in this section. If you want to speak, please raise your hand. To raise your hand, you go to the reactions. There's a reactions icon near the center at the bottom, and you click on it, and then the raise hand function will appear, and you just press on it and you'll be in the line to speak. Okay, hopefully no questions now. Sandra, are you just trying it, hopefully? Then you just press on it again to put your hand down.
Actually, I'd like to speak later when I can.
Later?
Yeah, whenever
Okay.
you want us to speak,
Okay, that'll
because
give
I have a big problem that I think is helping out, or actually not helping, is causing a lot of our healthcare crisis.
Okay, if you could please put down your hand, and then we'll
Okay.
get back to it later. It's going to be in a little bit.
Thank you very much.
Okay, thank you. So thank you once again all for attending. This is fabulous. We have a great turnout. It certainly means that I'm going to take from it that we all care about our public healthcare system. I know that there are others who were supportive who would like to attend, but were not able. And our mayor, Brian Patterson, our MP, Mark Gerritsen, have other commitments. And our MPP, we're very lucky to have here right now. But if he leaves, it's only because he has another commitment. And so it's really nice that Ted is here for the start. Ted Shue. This town hall is part of a provincial campaign to educate and motivate people to act to protect and improve our public healthcare system. As you know, the Ford government is planning an unprecedented privatization of our healthcare services, including long-term care, home care, COVID-19 vaccinations, surgeries, and diagnostics. Ontarians need to have a well-functioning public health system where people can get the care they need when they need it. Our healthcare workers are under stress. Thank you very much to all the healthcare workers, including local administrators, for providing us with the best care that you can. Our healthcare workers should be appreciated and supported. Sadly, funds and precautions are being withheld by the provincial government. Our hospitals are in crisis, and most recently, we've seen the pediatric hospitals joining the ranks of being overwhelmed and under-supported. Over time, shortages have become the norm. We, and those before us, demanded, paid for, and built local hospitals. Together, we need to stand up to help and improve our public healthcare system. We ask that you commit to become one of our million public healthcare defenders. It will take us all together to support our public system. So thank you very much. Now we're going to go to our wonderful speakers, and we're going to start with Bernie Robinson. Bernie Robinson has been a registered nurse for over 30 years. Bernie has worked at the St. Francis Memorial Hospital in emergency and acute care, complex continuing care, dialysis, telemedicine, and the Lynn Nursing Clinic. She is the interim president of the Ontario Nurses Association and is a board member of the Registered Nurses Association of Ontario. Bernie?
Thank you, Joan, and thank you to your chapter for hosting us tonight, as well as to the Ontario Health Coalition and Natalie, as well as the other peer presenters that are here. I am actually we aren't the Registered Nurses Association of Ontario. We are the Ontario Nurses Association, and it's okay. It's actually a thing that gets mixed up quite easily. So we are the union representing 68,000 nurses and allied health care professionals across the province, and also 18,000 nursing students. I am really grateful to be here with all of you tonight and to have the opportunity to share what is happening in our healthcare system now and why we know that privatization is not the answer. At this point, anyone who is paying attention has heard it before. Our nurses and healthcare professionals have been stretched. They've been stretched well beyond the breaking point. We have been in a crisis mode now for almost 3 years. And at some point, it truly is not a crisis anymore. It is really a new reality. And I think we all know that this can't be our new reality. We do know from new information that we have from the Canadian Health Institute for Health Information that the data states that Ontario is the worst in the country when it comes RNs per capita. Across Canada, there are 830 RNs per 100,000 people on average. But in Ontario, we only have 668 RNs for every 100,000 people. To put that into perspective, that means that just to be at the Canadian average, Ontario needs to hire almost 25,000 RNs immediately. 25,000. What does a staffing shortage of this magnitude look like in practice? It's become commonplace for our nurses to be kept at the hospital for hours after their shift is supposed to end, because the next shift is either short-staffed or it's not possible for them to safely transfer patient care. We have nurses who are working on maternity floors, for instance, that should have 35 RNs on a shift, but there's only 17 or 18 to do the work. We have hospitals where there are more vacant RN positions than there are RNs on staff. The situation has gotten so out of hand that here in Kingston, they were taking on children from Ottawa and Toronto because there weren't enough beds to accommodate them in their own communities during the RSV outbreaks. Taking on these patients is the right thing to do to ensure that they receive the care they need, but it also adds to the tremendous strain on a short-staffed nursing team. And I've just gotten some information this evening from our union leaders there in Kingston, who say that the PEDS beds expanded in the pediatric critical care unit by training ICU nurses. With not enough nurses, they plan to team nurse. Children are not little adults. They are a specialty unto their own, and they need specialized nursing care. This summer, they did see sections of their emergency department close due to staffing shortages. And the bed closures, of course, mean longer wait times, higher nurse to patient ratios, more burnout. There's frustration in the community when they aren't being seen on time. It is leading to some violence in these places, which has also been a strain on our nurses and healthcare professionals. They experience reassignment and load leveling daily. Many of the nurses going to work don't know if they're actually going to be on the unit they're assigned to or not. And this leads to decreased job satisfaction. Ultimately, they're not going to stay. There's not enough there to keep them interested in their jobs. They are tired, they're beaten down, and they're worn out. We know that nurses are resilient and resourceful and try to do the best they can to always put patient care first. And even in these extremely difficult times, Our members have truly found ways to provide the care that they know that all patients need and deserve. But the cost of this burden is taking a toll. We have early retirements. New grads are rethinking their careers and leaving after only 1 or 2 years on the job. Nurses are leaving to work at private agencies where they can ensure they have a work-life balance. Many of them are having moral distress. This is a very real cost to our healthcare system as the situation worsens. And now the full picture is truly coming into view. This Ford government is setting the stage to use this crisis to justify their privatization agenda. Ford has taken an understaffed system and made it so much worse by introducing Bill 124. Bill 124 caps the wages of many nurses and healthcare professionals and violates our Charter of Rights. Ford has refused to work with healthcare professionals to invest and implement a meaningful retention and recruitment plan that is leaving our system severely understaffed with no relief in sight. And now Ford is using this crisis, which he and his team have created, to push this plan to privatize our healthcare. We have heard the Minister of Health repeatedly say over the last few weeks that she has talked to healthcare professionals. She has not talked to people on the front lines. Across the country, Canadians pride themselves on our world-class universal healthcare system. We believe that this access to healthcare should be based on your needs and definitely not by your bank account. Nurses and healthcare workers are very strong advocates for the public, for nonprofit healthcare, because we know that about the devastating impacts of privatization. We have only to look at the broken parts of our healthcare system that are already privatized, like long-term care and home care. Private healthcare will take away from public care by pulling resources and staff from the public system. As nurses, we have already seen this, as some of our colleagues have left the public system to go and work for private agencies. Truly, we can't blame them, the nurses who make that choice. The agencies let the nurses choose their own hours, and they can pay more because conveniently enough, they are not subjected to Bill 124. There is a serious cost here. Those agencies charge outrageous prices to public hospitals, usually more than 4 times what it is to staff one nurse. They don't provide pensions, benefits, or sick days for their nurses, which in the long term is something that every worker needs. This undermines nursing as a stable career. It undermines our healthcare system by siphoning off precious dollars, and this just lines the corporate pockets. This will impact access and quality of care, and it will hurt patients who cannot afford to pay. We truly can't let this happen. Ontario's public healthcare system is not Doug Ford's to dismantle or sell off to corporate buddies. Our public system has been built up over generation, and it belongs to each and every one of us. At the Ontario Nurses Association, we are here with you. We will continue to work hand in hand with our allies to fight for the investments we need in our public healthcare system so that everyone gets the care they need and deserve when they need it. Together, we can stop Doug Ford's plans in its tracks. Thank you.
Well, thank you so very much for that, Bernie. And it's a shame, the conditions, and we need better. Thank you. Our next speaker is Michael Hurley. Michael Hurley is the president of the Ontario Council of Hospital Unions, part of CUPE. He has led tens of thousands of hospital and healthcare workers to fight cuts to public funding. He brought the struggle to stop P3 privatization of hospitals to Canada and was instrumental in rolling them back in Ontario. He has led countless legal initiatives, partnered with community groups to build people's movements to safeguard public health services, and fearlessly fought offloading and privatization of hospital services. Michael has visited Kingston many times to advocate for public health care, and we're very happy to have him back. Thank you, Michael.
Thank you so much. Thank you, everyone, for joining us this evening. The Minister of Health would have you believe that everything that's happening now in the Ontario hospital system is planned. Summer service closures at the Kingston Hospital, the multiple closures of the Perth ER, the closure of birthing services in that community, the enormous pressures at CHEO and pediatric care, the closures of 80 ERs over the summer across Ontario, including in Ottawa, Alexandria, Kemptville, Winchester, and many other communities. All normal, all planned. Well, I don't think it's normal. I think it's a train wreck myself. 260,000 people are supposed to work in the Ontario hospital system, but we are 47,000 staff short, and we have a turnover rate of 15% a year. And workloads for those people who are on the job are impossible. Our hospitals are regularly operating at more than 100% occupancy, with a staffing complement that isn't enough to cover 80% of the patients properly. For the hospital staff, there's constant pressure to work additional shifts, overtime, sick, injured. There isn't enough time to spend properly with each patient. Care is reduced to medications and treatments because that's often all there's time for. And over time, this takes a terrible toll on morale. The hospital workforce is exhausted after 3 years of the pandemic and demoralized because, as the previous speaker mentioned, the Ford government has effectively cut its wages by almost 10% in real terms. In any other profession that had shortages, employers would just pay more to attract new workers and retain the ones that they have now. But we don't have interest in that from either the hospitals or the government. For us to retain hospital staff, one of the key things we need to do is bring the ratio of hospital patients to staff up to at least the average from the bottom, from the lowest level in Canada, which we estimate would cost about $2 billion. Stopping the hemorrhage of hospital staff by giving them hope that workloads and the quality of patient care will improve significantly and that they will be fairly treated is a key starting point. You would want to do these things if you wanted to maintain a viable hospital system. But we know that the Ford government plans to invest substantially to pull diagnostics and surgeries out of public hospitals and into private clinics and private hospitals. The minister met with Caledonia Private Hospital in July. The minister attended a Chamber of Commerce fair on privatization of healthcare services, but as the previous speaker mentioned, has had no time to meet with the representatives of the frontline workers who have views about privatization and the impact that that would have in terms of devastating the existing service. Even though death rates in private clinics and private hospitals are higher, outcomes are less successful, costs are higher. Opening a market by commercializing hospital surgeries and other procedures remains a priority, and I would say an ideological priority for the Ford government. They've been very clear about that. It's in this context that the deliberate understaffing in our hospitals, the degraded compensation for the workforce, and the impossible workloads should be viewed. Are these things not accidents, but deliberately planned events to create a backlog of surgeries and other procedures and open the door to privatization? The Minister of Health tries to quiet critics by suggesting that the closure of 80 community ERs over the summer and now the huge pressures at pediatric hospitals are not crises at all, but planned events. And on the one hand, we surely imagine that no one would plan such system failures. We've never seen this, at least in my lifetime, never seen this in Ontario. But on the other hand, we know that this government is using the current weakness of the public hospital system against it to privatize the backlog of surgeries and diagnostics. And the fact that the Minister of Health has never tabled a plan to deal with the hospital staffing crisis, never answered a letter from the unions that wrote her about a staffing plan, tells you a lot about what you need to know. We know that the road to privatization can be a road from which there may be no turning back. And so we're here today resolved to defend our public hospital system from the latest attempt to privatize it. And we do that with a sense of history that reminds us that we collectively stopped the privatization of cancer care under the previous Mike Harris government, and the privatization of the ambulance services. Those were concrete proposals well underway in the 1990s. We did it then, and we can do it again. An aging and growing population is still a population deserving of quality care. A tired and demoralized workforce can be given hope and renewed energy. A hospital system pruned almost to the point of collapse can be brought back to vibrancy. It's vital that we set out our expectations for this government, but it's importantly that we set expectations for the citizens of Ontario. It's vital that we leave here tonight committed, each according to our capacity, to do what we can to battle to preserve our public hospital system in this province from privatization. I want you to know that you can count on the workers in our hospitals who are on the front lines to fight alongside you as we push together these privatization plans back. Thank you so much for the opportunity to speak tonight.
Thank you very much, Michael. I've got hope from that. I've got hope. It's like we've done it before, and it will take all of us to fight. So yes, there are problems. Thank you so very much. Our next speaker is Drew Cumpson. He's our patient witness today. Drew Cumpson is an accessibility and disability consultant with Accessible Consulting. One of the first times I met Drew was at an online town hall. And while there are many great contributions, I was struck by Drew's openness and insight. He has had experiences that few of us will ever know, and he uses that experience to work to make life better for others. On May 10th, 2011, Drew's life was changed forever. At the end of his second year of university, he was on a humanitarian trip with a group of students. On the last day of the trip, he had a swimming accident that left him a quadriplegic. After graduating in 2016 with a Bachelor of Commerce degree and a certificate in leadership, Drew has been an advocate for people living with disabilities and a voice for all. This year alone, Drew was a local candidate in both the provincial and the municipal elections. That's a lot of energy and caring. Thanks, Drew. Please tell us your stories.
Thanks, Joan. I appreciate that. And good evening, everyone. As Joan said, I had a spinal cord injury in 2011 that left me a quadriplegic and on a ventilator. I have been thrown into the healthcare field. I spent 16 months in the ICU at KGH and then 3 years at St. Mary's before moving home into my own house. I have learned how much our healthcare system is failing and how much it is failing now more than ever. The issues that have been plagued by our healthcare system and the Ford government's drive to privatize things is something that we cannot focus on. Our hospitals are no longer safe. I have lived in and out of them throughout time and have experienced all aspects of good staffing ratios and those without. Our ICUs right now are not safe. KGH ICU is not safe. The staffing levels are horrible. The nurses are trying their best to do everything. This ICU is typically a 1-to-1 ratio and always has been that until this year. Now the ICU is going at a 3-to-1 ratio, 1 nurse to 3 patients. And what that means is when one nurse actually gets a chance to go and have a break and actually gets a little bit of time to have a little bit of bite to eat and refresh and kind of clear their head, that means the other nurses are looking after 6 patients at a time. And that is no longer safe. Our hospitals are not safe. And even this summer, there was a death in the KGH emergency waiting room because our hospitals were not safe and there are wait times that are unprecedented in this area. We cannot let our healthcare system fail like this. This is all Doug Ford's doing, and he's doing it on purpose, like the previous 2 speakers have said. They have shown that they are putting our healthcare system into the break because they are wanting to privatize. They want this opportunity to say, look, our public healthcare system is failing, so we need to bring in private stuff. And then if what that means is if I go back to 2013, when I was looking at being discharged from Providence Care, St. Mary's at the time here in Kingston, to move home, I was told that I would need 24/7 RN care. And what that became was a quote from CBI Nursing. CBI Nursing quoted me 10 years ago in 2013 that 24/7 RN care would cost me $525,000 a year. And what does that mean? That's over $500,000 for me to live at home. But do you think those nurses are seeing that money on the front line? No, they are not. They're not seeing that money at all. And then now we look at what home care is like. Right now, the government has promised home care $1 billion, but we have only seen just over 100,000 and $100 million donated, put towards healthcare. And what that means is our healthcare is breaking. I have nursing care every day from the nursing agency. And what we have right now, I have 2 nurses that are trained to look after me and do my morning care with me. And what that means is that they are here every day. They don't get a break. They don't get the opportunity to have this. And the other issue with home care is they are paid the least out of every nursing site in Ontario. Home care nurses are paid the least. They are not paid for their travel time. They're not paid for their gas. They're not paid for their mileage. This means that these nurses are putting this all onto their back. They are the ones fronting the bill for providing care to people that need it, like myself and others. If we had enough support within home care from this government, we would be able to have a lot more people living at home and receiving the care they need and not be in the hospital when they don't necessarily need to. The issue right now is there are people in the hospital because they do not have adequate home care to go home to. And a friend of mine recently was just told a surgery has been waiting a year for, had to be canceled because there was no home care to be provided after surgery. So this is an issue that is faced by everyone in Ontario. And the issue is that our government does not care. They want this to be the situation so they can say, we need to privatize because obviously public health care is not working. But the issue is it's them that has caused all of this. And there is so much going on that people are not aware of, and they are trying to make sure that people are adequately cared for. And home care is supposed to help with that, but it is not. And they need to step up and provide the rest of the funding that they have promised to the Ontario home care sector. I know as someone who relies on nursing daily, relies on PSWs, I have 24/7 PSW care. And that is not through private, that is through the government, through a program called direct funding. They provide me with the money and every month to hire and train and schedule my own caregivers for 24/7 a day care. And what that means is right now, I do not have enough PSWs. I have searched and have posted job postings every month for the last 7 months, trying to get enough caregivers to take care of me on a daily basis. It just is not there. There are not people looking for work right now in the field. They are trying to get out of the field as much as they can. And that has become one of the biggest issues. And right now, it's a struggle. There's days where sometimes I have to rely on my 90-year-old grandma to listen out for me if I do not have a caregiver for an hour or two. And that's not right. My grandmother should not be doing that at 90 years old. But this is what the government is forcing people in healthcare to deal with. And unfortunately, there has been no effort or try and change in terms of healthcare right now. And our government wants that because this is how they can guarantee and force privatization onto everyone. Unfortunately, there's not much we can do as of right now, as in my situation, but as a whole, we need to stand up and focus on creating the change that's necessary, providing the funding. The government needs to provide that funding to home care. They need to be increasing home care support, increasing home care capability so that people can get out of the hospital, so they don't have to be in a hospital, so our hospitals can actually be for the acute care patients that need them and not for those who do not necessarily need to be in the hospital. So for me, right now, our action going forward is to make sure the Ford government provides that rest of the money they have allocated to home care at $1 billion and be able to make home care sufficient for people to be able to live at home, receive care, be discharged from hospital after a surgery, and receive that nursing visit to help dress their bandage or make sure everything is good. And so right now, that is the focus. And as someone who has lived through it, this is the worst our healthcare system has been in the last 11 and a half years that I've faced it as a patient, as someone who utilizes it on a daily basis. Thank you.
Thank you, Drew, and thank you for giving us such a specific evidence of what's happening and for giving us actually a goal too. So thank you very much. Our next speaker is Natalie Mera. Natalie Mera has been the executive director of the Ontario Health Coalition for 22 years. She has built the Health Coalition into the largest and broadest public interest group on healthcare in the province, representing more than 750,000 Ontarians in its network of more than 500 member organizations and more than 50 chapters. She is a former board member of the Canadian Health Coalition, where she spearheaded numerous national campaigns to safeguard and improve single-tier public Medicare. She is a contributing author in 3 books on healthcare policy, privatization, and building the movement to protect public healthcare. She has written hundreds of articles, reports, and submissions, and testifies regularly before legislative committees, and is featured in hundreds of media interviews on healthcare. I'm going to turn it to Natalie in just a second, but could everyone make sure that they're muted before we hear from Natalie? And once we are, Natalie, please.
Okay, thank you so much, Joan. And thank you, Bernie and Michael and Drew. I'm not going to I'm just going to show you kind of visually some of the things that we've talked about quickly. And I'm sorry, I had to duck out, but it's relevant to this because I was talking with a mom of a very seriously disabled daughter. She has a neurodegenerative condition. And so the mom is really used to doing all kinds of complex medical care at home. And she took her daughter to Sick Kids because she was in an emergency, rather serious emergency. She's on a ventilator, and so she needs help breathing. She needs help with feeding. So she needed to get into the hospital. And the hospital was so overwhelmed that she was in emerge for 21 hours and ultimately was sent home without being able to get into the hospital because the hospital was so overwhelmed and because they felt that she was safer there. And honestly, the mom said in the end, her daughter probably was safer at home. She had, you know, I mean, she was in, this mom would not go to emerge without it being an emergency, right? They're used to this. They are in the trenches day in, day out. They know what is an emergency, but there was no care. There was no, it took 2 hours to get a ventilator for her there. You can't hook up your own in the hospital. You're not allowed. When she was desaturating, her oxygen levels were desaturating. That's a very serious for a kid, 11-year-old kid with the kind of medical complexity that her daughter has. And no nurses came. Took a long time for the nurses to come. And there was no food. They didn't bring food. They brought her meds, she said, thank God. So she had her medications, but there was just, I mean, they're just completely overwhelmed. She said that she brought her home care nurse with her because you can't leave her daughter alone at all. You can't go to the bathroom and leave her be. And the nurse, and she had never seen anything like this before. That is the state of our pediatric hospitals now. Now, you know, our adult hospitals have been in that shape for quite some time, actually. And so when Drew talks about being a person who needs home care in order to be able to live, you know, the best, fullest life that he can without being stuck in hospital, others are, you know, stuck at home trying to get into the hospital to get the care they need. You know, it's a bit of a mixed bag out there. The problem is that the capacity across the whole health system, long-term care, hospital care, home and community care, is just not there. And there's a reason for this. Tonight, we're talking more about the hospital crisis because we haven't lost the hospitals yet. The government is trying now to move to privatize the hospitals. We're trying to save them. That's the bottom line. And they're letting this crisis go. And I know Michael and Bernie described it, you know, and they're not doing anything about it. Like, what's shocking is the Ford government is doing nothing really about the crisis. And so, but it's not really a surprise that we're in this situation because Ontario has cut its hospitals beyond any jurisdiction in Canada, and as Michael would have told you. I just want to show you what this looks like. So these are the number of hospital beds per person. That's how you measure it. So these are per 1,000 people by province. And you can see Ontario's at the bottom, right? And it looks, you can see more visually here. So Newfoundland and Labrador at the top, Ontario at the bottom, a long way behind, almost about half of the hospital beds of the provinces on the East Coast. The average is 1 bed per 1,000 more than we have. So you can see that here. So what that means, Ontario has 15 million people. That's 15,000 thousands. We're 1 bed per 1,000. So we're 15,000 beds short of the average of the rest of the country. Just to give you some context, right? How different things would be had we not cut our hospital beds, downsized our hospitals beyond anything anyone else has done, you know? And it shows also that these are political choices. So how we got there, well, I mean, it was a purposeful policy. I'm going to share my screen again. This is all on our website, by the way, if you want to see it. It's here under the, hang on, I'll go back to the main site. If you go to the main site, underneath, there's kind of a slideshow that revolves here along the top. And then directly below it says health system facts and trends. And you can find all this here with the sources and everything, if you're interested. But so I'm just going to go to funding. So hospital funding in Ontario. Okay, here we are. So can you all see that? Here we go. So Ontario's hospital funding is the lowest of any province in the country. There's multiple different ways you can measure this. This is as a measure of GDP. That's our economic output. It's kind of the measure of affordability, like how much of your total economic output are you spending on public hospitals, and we're the bottom of the country. And you can see again, half of the provinces on the East Coast, and below anyone else, right? And I'm gonna go back again and just show you another measure. So another way to measure would be per person. So if you look at Ontario's hospital spending per person, there we are, bottom of the country again, and a long way behind the average, a long way behind our peers. And you know, if you look at healthcare funding, I'll do this one. You can see we're second last in the country for healthcare funding overall. Speaks to what Drew was talking about. Like, we need home care, we need long-term care, we need hospital care. But the bottom line is that they have purposefully constrained hospital funding in order to force the hospitals to offload services, to cut services, and to cut beds. I mean, that's the bottom line. And so if you maintain funding like at a 0%, like for 10 years, which is what we had, while inflation goes up and the population grows and so on, there's no choice, but hospitals have to cut the range of services. Everything cut from public hospitals is privatized. You know, all the chronic care beds, they shifted out to long-term care. They were public in the public hospitals. They privatized them. Gave them the majority of them to for-profit companies. Home care, 80% privatized. Long-term care, 67% privatized to for-profit companies. And now they're going for the hospitals themselves. And, you know, every clinic, everything they move out to clinics is private for profit virtually. And that's what they want to do. So now they want to take the profitable services, the profitable surgeries and diagnostics out of the public hospitals to for-profit corporations. And so I just want to say, like, what's shocking is no matter what, we still have to run public hospitals. They'll only take the profitable stuff. They'll take the staff and the money that goes with that. There'll be less staff and money to provide everything else for everyone else, but you still have to run public hospitals. You can't just let them go on in this situation. I mean, how long can you ask nurses and health professionals to work 12-hour shifts with impossible workloads, you know, and be called in every minute they're off? You know, we're talking to a respiratory therapist working 70 hours a week. These are the people that intubate patients, right? So in all of this RSV and through the entire pandemic with COVID, they're working nonstop. And every minute that they're off, they're getting calls to come in and do more overtime. It's not possible to live under that kind of stress. And yet nothing is happening. And on the flip side, and it's the flip side of the same coin, they're trying now to privatize our services. And I guess I just want to say one other thing. We won't be able to protect single tier public Medicare in this province and this country if they privatize those services. The for-profit clinics, we phoned all of them across the country multiple times. We posed as patients if they were selling, say, shoulder surgeries. We said, I'm a patient, I need a shoulder surgery. I want to jump the queue. How much can I, pay to jump the queue and get in fast? And all of them, virtually all of them, the vast majority of them were selling healthcare services for extra money. So they bill OHIP and they bill patients on top for their surgeries and for their diagnostics. And the prices are outrageous. An MRI in a private clinic starts at $1,000 in many parts of the country. In the public system, if we want to ramp up volumes for MRIs in the public hospitals, it costs like $280 to $350 on average, not the starting price, the average price. Shoulder surgery, private hospital, 10 times the cost, 10 times the cost of the surgery in a public hospital. In the private clinics, they're charging $2,000 routinely for cataract surgeries. They can't charge you for a cataract surgery. There's probably people on this call who've been charged. They're not allowed to do that. Under the Canada Health Act, it's forbidden to extra bill patients. You've paid in your taxes. That service should be free to you when you need it. When you're elderly, when you're on fixed incomes, when you're least able to pay, they'll charge $2,000 for a cataract surgery that OHIP pays the physician $550 for. It's a 7-minute surgery, right? They charge $200 routinely for extra eye measurement tests, and don't tell the patient that they're medically unnecessary. The eye measurement test that you actually need is covered by OHIP. None of this should be happening. But the business model of the private clinics is to charge OHIP or the provincial equivalent in other provinces and bill patients on top outrageous prices. So we're in our assessment of this situation is that it's super serious, that, you know, the Ford government did announce this in August, middle of the summer. They called the legislature back in. They never sit in August. But this is when most people wouldn't be watching, right directly after the election, so as to get it in and done when the least number of people are watching, as far away from the next election as possible, and make it as undoable as possible. And that's what we have to overcome. I know we can do it. Michael talked about what we've won, you know, in terms of the cancer, stopping the for-profit cancer surgery. We've stopped the closures of emergency departments in Wallaceburg, in St. Joseph Island. We stopped the closure of the hospitals in Fort Erie and Port Colborne. We saved the birthing units in Midland and Leamington and many other places. You know, we've stopped the closure of services over and over and over again. Every time they've tried to privatize the hospitals, we've stopped it. There's no question we can do that, but we have to fight. And that means you and me. Like, there is no other force out there to do it. It's going to be us. And we have some ideas about that. We want to hear your ideas tonight. And I just want to close this along. Does anyone remember Ralph Klein? He was the premier of Alberta. Do you remember him? So he came into government. It was these were like at the same time as Mike Harris in the 1990s. These were the first governments that really wanted to bring in a kind of radical revolution, cut public services dramatically, major cuts, and privatize. And they were trying to really like push back the gains of, you know, social services and public services and so on that had happened over the last century. And so he came into office all, you know, macho, and imploded blew up the Calgary hospital, imploded it. And it was a symbol, you know, of his revolution and so on. And you can actually see the video if you look online. It's look for Calgary hospital implosion. And then he privatized the MRIs and CTs. And our sister organization, the Alberta Friends of Medicare, they got all the patients that were being charged for MRIs and CTs in the private clinics to come with their bills, their medical bills. And they forced the Alberta, we held protests across the country. They had major protests, forced the Klein government to pay back all the patients that had been charged in the private clinics. And then they rolled them back into public hospitals. They built MRI capacity in the public hospitals, and they stopped the private clinics. The Ralph Klein government, I mean, a radical privatizing government. It was amazing. When they brought in a piece of legislation to privatize the hospitals, they filled the galleries of the legislature. I remember watching it on TV. There were people hanging from the banisters in the gallery of the legislature. And Shirley Douglas, who's the daughter of Tommy Douglas, whom some of you may know, and the mother of Kiefer Sutherland, whom some of you may know. She's kind of a famous Canadian actress, and her dad was like known as the father of public Medicare in Canada. She describes it this way. She said, you could stand outside the legislature, and you know how the prairie is really flat. You could see the cars lined up down the prairie. You could see the lights of the cars down the prairie as far as the eye could see, like an endless line of cars coming in to protest the privatization of their hospitals in Alberta. And in the end, Ralph Klein said, public health care is the electric third rail of Canadian politics. You know, when the train goes down the track, and then there's the third rail that carries the electricity, and you daren't touch it because you'd get electrocuted. And I always loved that. I thought, you know, let those bastards be afraid to touch our public health care. And so what we're doing is we're electrifying the third rail together here, make them afraid to touch our public health care and protect our public hospitals. Thank you.
Thank you very much, Natalie. Once again, you know, really maddening information, and yet you give us like hope. That is great. Thank you. So just on a Kingston note, we did actually fight. I almost forgot about that, but we did fight, and we kept Hotel Dieu open And so that's pretty big. I remember we had a plebiscite. We had about 10,000 votes against a P3 hospital. That's a good activation of members. And of course, while we love standing on street corners and picketing with information, and we get lots of support and even lots of questions. And just recently, our city council actually has chosen to investigate creating more municipal, like public, long-term beds. So from here, we are looking, so we'll be open for questions, and then I'll look to Natalie too to motivate us to do to do actions in the future. So if you have a question, if you would please, as I mentioned before, go to the bottom to the reactions and press on it, and when the hand up, the raise hand function, press on that, and then we'll take the questions. When you ask a question, if it's to a specific person, can you please say who the specific person is? Or if you have great ideas and ideas to motivate and you know, change the direction of our privatization, we are welcome, happy to hear it. So we have someone, and sorry, my glasses aren't so great. Trisha, please.
So yeah, I just wanted to make a couple comments. So I actually took nursing years and years ago, and then I went back to pharmacy, and I've been working at a hospital for 20 years now. And I've seen a huge difference in 20 years ago and now. And I feel like when people say, oh, like our staffing crisis is bad, but I don't think a lot of people in the media really realize how bad it is, because for 10 years now, most of us have been short-staffed. And now it's not even bad, it's horrible. And I work on the floors a lot of times, and I see, and I know so many people that work at the hospital. So I know housekeepers, PCAs, nurses. And even yesterday I was on the floor, and one of my friends, it's a nurse. She's a critical care nurse, and she was in emerge. And I saw her at 6 o'clock last night, and she's like, I have to go to the bathroom. I haven't gone to the bathroom since 5 a.m. Like, and then you hope that something will change. And you have all these people that are so discouraged, because I even look in the last 10 years, nothing has changed. It's gotten so much more worse. And you try and encourage them and say, you know, you got to have a voice and you got to say something. But I kind of get where people are like, no, because even me, I've said it to our union people, where it's like, no, like nothing changes. People are being treated poorly. It's not about money. Every shift I'm there fixing problems, I see these guys crying. And then we bring in these new staff, and I feel so bad for them because they don't know any different. And they're running around trying to take care of 8 patients. You know, I don't even know what to say to them anymore. So I don't know who my question's for. It's more of a comment, but I don't know who to say anything to anymore.
Right. Well, thank you very much for actually sharing that with us. And I do want to once again, I'm going to echo what Natalie said, is thank you very much for all the work that you do, the healthcare workers, that you continue to like work so hard. That's wonderful. And locally, I know that any of the problems are not yours. It's the funding and it's the government's choices. And we have to change that. So I'm going to look to any of the panelists who would like to respond to that. Please.
Just thanks, Trisha. I mean, thanks for your service. Thanks for sticking with it and for supporting your colleagues. And like, I mean, these are two sides of the same coin. We need to demand the key things that the Ford government has to do in order to bring staff back, get staff in, so that, you know, to deal with the urgency that's required with the staffing crisis. And when, you know, I think Michael and Bernie both talked about some of those concrete things, and you also mentioned, but I mean, they're pretty clear. It's not sort of, you know, beyond doing. Of course it's doable. And then the other thing is to stop dismantling our public hospitals, to privatize them, right? And so they're flip side of the same coin, and those need to be our demands, you know?
But how do you make them do that?
Well, we have to pour on the pressure. And after a couple questions, we can move to we have some ideas about how to pour that on the pressure for sure. Yeah, I think that's the key question here tonight.
Yeah. Yeah,
I think so too. Thank you.
Thank you very much. Next is Susan. You have to unmute yourself. Sorry, if Susan, if you're talking,
Here,
I can't.
here,
Okay.
can you
Okay.
hear me now?
Now we can, yeah.
I having great trouble with my phone. So I believe the Ford government somehow all became deaf and don't have been unable to buy hearing aids since they were all elected. And I look at the CUPE example of last week and all unions standing shoulder to shoulder for what was a bad deal. I think it's time for people use your feet. Now, as an RN, I'm fully aware that to leave patient side is nursing abandonment. But I'm not sure every healthcare worker would lose a nursing license for walking away and saying, enough already, and creating a huge mess. It's already a mess. We can't make it any worse. So I don't think talk is going to work with this government. I mean, he's disrupted everything. We know it's a government that all of us are to if we didn't vote, are at shame, because it was something like 33 or 34% vote popularity that returned a majority government that really only represents 18% of Ontarians. So he's got this mandate to rip things apart. A couple of things. I have worked a lot in my nursing career with CIHI, which is the Canadian Institute of Health Information, of where across the country we submit data. And I think that's what Mr. Trudeau is talking about when he says he wants the data. At no time has it been talked about turning that data on so that we see where the most acute needs are and fund according to it. So that's one area that might be of consideration, that the government might actually be able to say, hey, I know it costs more in this hospital compared to that hospital because of the data submitted. So that's a concrete thing. But on the frustration end, I've been involved with lobbying with this government through a different part of the Registered Nurses Association, and have been to Queen's Park. They just call you in, you make your trip, and they nod their heads like bauble dolls, and they walk out and they say, well, there now we solved that piece of the legislation that says we must listen to them. But I didn't really listen. I was playing on my phone and I didn't hear anything, and I'm going to do what I want to do. So that's my 2 cents worth is if we want to give them something concrete to actually start turning on their CIHI and start funding by data. And but more immediately, how do we just simply walk out on this group? How do we stage some sort of a walkout on whatever sort of a day to say, you know, or you know, like surgical nurses, if there's surgeries booked, say, hey, we're not going to do surgery today. You know, I know you can't walk out on a patient, but I think we have to become a little more militant. Healthcare professionals, including myself, have never, ever been that type of person. We were there to look after it. This Bill 124, what's been asked to be repealed. What we found, if CUPE could be a bit of a eye-opener for us, is there is all kinds of support out there through community that are sick of this as we are, and we need to just be a little more forceful. That's my 2 cents worth.
Thank you very much, Susan. And I think actually you actually balanced it, well, showed the frustration, but also balanced with concrete ideas, with the recognition that it's going to take all of us to fight back. And talking nice isn't necessarily, well, I mean, we'll always be civil, but we doing it the ways that we've done it might not work. And so we have to find innovative ways to do it, and we have to be together. And that's what we're here tonight for, is to develop, to you know, A, to educate, and then motivate that we actually take action. Natalie, did you want to
Oh, I actually thought Bernie and Michael might want to say something here.
Yep.
Yeah, so I will tell you that ONA is doing their best to get the message out. We have actually been out picketing against Bill 124 for over 3 years now. And we have put lawn signs on our lawns. We've talked to passersby. We have, we made it actually part of the election issue, especially with our members, because the government passed a bill that you could only talk to your members. You can't talk to the public about that, or they charge you an extra bit of money. So we have been trying to certainly get that message out. We will not stop. We are going to continue to get that message out. We're going to speak out about privatization. We've been at Queen's Park almost every day in the last 2 weeks. And I'm telling you, we do need to stand together, not only as union groups, but as communities and as the public. And that's the only way that we're going to ever get anywhere.
I would just add to that, you know, the healthcare union's principal vehicle for dealing with healthcare policy is the Health Coalition. But we also acknowledge that the workers have a responsibility to defend the system. And so we did announce this week a campaign to push back against privatization and on the wage issue and the workload staffing issue. And there will be a series of regional demonstrations coming. There will be one in Kingston in March. We'll get you more details as soon as we have them. And we'll be moving to some sort of demonstrations at all the hospitals as we get closer to a provincial election. So, I mean, we're very much in sync. The question of tactics, Susan, is a question that, you know, is a very rich question, you know, you know, would be a good discussion for us all to have.
And those are the five big healthcare unions. So that's like QP, ONA, Unifor, OPSU, SEIU, right?
Correct.
All working together. Okay, that's new. So they just announced that like 2 days ago? Yeah.
Last week. Okay, great, thank you. We will move to our next question, and Kathy, if you could unmute yourself, please.
Hi, just a thought here. I campaigned for Ted, who was here earlier, and I noticed when I was doing, you know, door knocking and talking to people, people are not informed. A lot of people don't realize that healthcare is a provincial matter, as is education. So I can't tell you how many people I talked to that were bashing Trudeau for all of the problems that we have. And when I explained to them that these are actually provincial matters, they were dumbfounded, just dumbfounded. And I don't even think that some of them believe me. So, but the thing that I did want to draw forward, whatever plans come out of this and other planning meetings, I'm all in. But I mean, it's fine to protest and march, but you only seem to get the people who are driving by. What about a door-to-door campaign? And I don't mean stand and talk to doors. I mean drop stuff off at people's doors, and have it be like right in their face. Not, you know, oh, our healthcare is in trouble. I mean, blast them. We're at critical point here, and we cannot be friendly and we cannot be nice and polite like we always are. I think it's time that we go big and we blast people and tell them what is going on. That's basically all I had to say, but I'm all in because I campaigned every day for a month.
Thank you, Kathy. Yeah, certainly without common mass media, that certainly changes things. Any panelists like to respond?
So yes, as Kelly said, as a candidate in the election, people don't understand what levels of government actually do and what government levels are responsible for each aspect of our healthcare or our education or mandates even. So that is where I found there needs to be a lot more education, not only on politics, but on how our government actually works, because people don't understand how it works. And that seems to be the big issue. So I found that was one of the biggest things going door to door and doing that during the campaign as well, is that people are not aware of what actually is done by each form of government. And it is time that we really show what needs to be done in Ontario and push for the Ford government to stop what they are doing and be representatives and make sure everyone fights for their own healthcare, because it's not just one person's healthcare that's affected by it. It's every Ontarian's healthcare that's affected by it.
Thank you. Any other panelists? Okay, thank you. We'll take a couple more and then we'll move on. And there's a few ideas about the Canada Health Act in the chat, and I'll look for people to respond to some of those things. So next, thank you, is Sammy.
Oops. Okay. Hi. So I'll just turn my video off. It's really dark. But I'm a social worker. And I missed the first part. So I'm guessing this is a town hall sponsored for nurses. Is that right?
Actually, it's sponsored by the Kingston Health Coalition and the Ontario
Okay.
Health Coalition. So we are really supporters of public health care. And so
Okay.
we take it on various places.
So I work at a hospital as a oncology social worker, and I'm also a home care social worker. And so I hear a lot of comments about, for example, people not getting PSWs, as Drew mentioned, and needing more nursing, etc. So I'm just wondering, and I'm still new to the social work profession, but if a patient was to bring up this issue and initiate that kind of conversation, is there any option where we could have, say, like a pamphlet and be like, yes, glad you brought it up. Here's some information. I'm still unsure about, how to be non-political in the role, but at the same time, recognizing this is an issue and they've initiated the conversation about it, affecting their healthcare. So just a thought there. And I do agree and just want to echo the part about not getting paid for mileage. I know someone commented saying you do get paid for mileage, but as a social worker, you get paid per visit. So you don't get paid for your notes. You don't get paid for any of your extra homework, your phone calls, your mileage. It doesn't matter if you spend 10 minutes with them or 2 hours. So obviously you're incentivized to spend as little time as possible doing your work with and for your patients. So glad that was brought up.
Okay, thank you very much. And sometimes, yeah, it is a fine line. It's good to look others. Well, the Kingston Health Coalition does like advocacy and fights, but is not partisan, just a fine line there. But I don't know if one of the panelists would like to talk, respond.
So we do have some leaflets and things, and Sammy, if sorry, I hope that's your name.
Yeah, Sammy.
Okay, sorry. So like if we can sort of make one that fits well for the kind of work you're doing, we can absolutely do that. And just like make sure we have a whole bunch of different things on our website, and we have a leaflet about this in particular, but we can do that. And I just wanted to mention Erica Ben is here too, and she works in the hospital. I did want to forget to ask her at some point if she can like give us her account of what's going on the ground in KGH, right? But when you're there, Joan, and I'll show you more about the leaflet and stuff when we get to the action plan after the next couple.
Excellent. So we're going to take the next two and then we'll go with Erica. Perfect. Perfect lineup there. So next is we have Maeve and Marilyn, and then we'll get to Erica, and then we'll look to next steps. So Maeve, please.
Hi, thank you. I just wanted to very briefly speak kind of from the perspective of like a younger person, a university student. I'm just not noticing many people my age that are concerned about this, that are speaking out about this. And I think it's really important in terms of that idea of like educating people, meeting people where they're at. I also know that it's my demographic that is significantly failing right now in terms of getting out there to vote and kind of make these changes, and is kind of apathetic. And I think that's really dangerous because it's young people that are also going to be immensely affected if the public healthcare system collapses or changes. doesn't take much more than a quick Google search to remind yourself how much it costs to have a baby, for example, in the United States, not to mention all of the other folks that would be impacted. So on that idea of education, I'm just wondering, are there ways to get out there on social media? Are there ways to activate people of my generation and get them speaking out? Are there ways to connect with influencers on social media? I see a Facebook group there, which is awesome, but I'm wondering about even taking it further to really get this rolling and get young people activated about this issue, because we will be immensely impacted if things change. And I think we take this system immensely for granted. So yeah, can we connect with influencers? Can we get social media kind of rolling on this issue? Yeah, just something to think about.
I'm just going to speak with local social media. We have Facebook, we have Twitter, we have Instagram. Yeah, it's just how do you get people amplifying it and buying in, and we'll hopefully we'll build networks out of today. That's what today is, and then we can build them from there. Others, and I know Ontario Health Coalition has fabulous Twitter and Facebook and others. So anyone else want to?
We're on Instagram, TikTok, Twitter, Facebook, and Reddit. But we need more content.
Yep.
So Maeve, like, let's talk as we get into the, hopefully very soon, into the action plan, because we need to generate more content and more content that is like of the sort that you're talking about. So I've got it down. Let's come back to that in a minute.
Excellent. Okay, thank you very much. Yeah, good. We're coming back. We're making lists, so that's great. Marilyn, please.
Hi, I'll be very brief. When Natalie first started, and she lived in Kingston for a number of years, and so we go back a long time. When she first went to Toronto to head up the Ontario Health Coalition, maybe it's there a year, she had a brilliant idea, which we did across the province, which was having a petition, which we took door to door. I organized it here in Kingston. We got over 8,000 signatures. It was the easiest canvassing I've ever done in my life. Almost everybody wanted to sign the petition to keep our healthcare public, and it was a way to engage the general public. And thank you for the person who mentioned canvassing during the election. That reminded me of that, what I felt was a very, very excellent campaign.
Thank you, Marilyn. Any comments? Pretty well
Matthew just Michael just put his thumb up. Maybe Michael.
Excellent point, Marilyn.
Yeah, so all those, and once again, canvassing, it great idea. We need to have people going out because it's important to have those conversations. Okay, so Erica, please.
So I hope that my internet is okay. Can you hear me?
Yep.
Okay, good. I've been having internet issues all night, so I apologize if I cut in and out. Like Natalie said, I'm the president for the OPSU local at Kingston Health Sciences Center. Like everything that's been talked about today, you know, my members are seeing severe shortages. Talking about accomplishments, February 13th of next year will be the 20th anniversary of OPSU's Day of Action. We were not getting fair bargaining, and we walked out. We did an illegal one-day strike. We walked out, and the next day the government wanted to give us 2 or 3%. We were asking for 23%. And the next day we got a 14% deal. Day after our Day of Action. So that's 20th anniversary. We've done it before, and I can tell you that my members are ready for it again. They keep asking when we can do it. The other point I wanted to make is, you know, we have more than 200 classifications within OPSU in the hospitals. And just to name a few that are severely short-staffed, and it's not just provincially, it's across the country. Med lab technologists, pharmacy techs, radiation therapists, respiratory therapists. I could probably talk for 10 minutes just of the classifications that don't have enough people. I think one of the big things we need to push this government for is somehow forcing the colleges to increase their students that they're taking in. You know, just med lab technologists alone, we have over 400 vacancies just in Ontario, and we've only produced 75 new med lab technologists each year provincially. So we can't, we're not even producing what we're vacant on, and that's across every profession within OPSU. So I think,
Erica, can I just ask you, where do you, like, what kind of health professional are you?
I'm a med lab technologist.
You're a med lab tech. Okay, so you work in the labs, you do all the COVID testing and so on.
Yeah, the labs do the COVID testing. I'm in the chemistry lab, so I'm doing, you know, your sugar level, your enzyme level for when you have a heart attack, those types of things. But there is many different labs, and microbiology does the COVID testing. Yeah. Yeah. So yeah, I think that's one of the, you know, apart from, you know, Bill 124 and all that stuff, we need more graduates. We need more people in the profession. We have close to 40% of, you know, again, just med lab technologists, 40% are due to retire in 5 years. So that's what we're seeing across all of our classifications.
Thank you. Thank you for that information and what's going on. Yikes, we need those people doing those tests. We need that information. Yes. Yeah, so that's actually another one. Yeah, another put more colleges, more spaces. Okay, thank you. So here I'm going to turn it over to Natalie in a minute, not even a minute maybe. But what I've heard is a few things. Just people are keen about canvassing, or the idea that there should be canvassing and pamphlets and maybe a general strike, and that we more content on social media and spaces in colleges. Those are things here. Now, it's going to take all of us, all of these ideas. We need you to join in. You are fabulous Kingston interested people, or Kingston area, and if you could join the Kingston Health Coalition, that's great. And our next meeting is, we'll say this again, whoops, went too far in my calendar, is the 18th of January, and it's online. So please, we'll be contacting you, and we need to follow up. But I'm going to move to Natalie, please.
And I'm just going to recognize Bernie quickly.
Yes.
Bernie, go ahead. Sorry.
Bernie, please. Yes.
Yeah, so I'm seeing in the comments all the support for nurses, and if we walk out, you know, we are bargaining a collective agreement starting in January for hospital nurses across Ontario. We represent the nurses in almost every hospital in Ontario. Most of those hospitals are in the central collective agreement. And so we start bargaining with the government at the end of January. And nurses will not walk out on their patients. I will tell you that. But nurses that aren't working, we are hoping that they will demonstrate. And I hope every member of the public will join them that can, to say to this government, you need to bring a fair deal to the table. It's not all about money. It's about working conditions. It's about providing enough nurses on a shift so that every patient gets the care they deserve, not just chopped up little pieces of care. And so that's just the message that I thought I would give, seeing the comments, and thank you very much for them. I'll be sure to tell my nurses.
Thank you.
Thank you.
Thank you. Okay, sorry.
I'm just going to add on a personal note. I was actually part of the education workers, most of the teacher unions that did do a 2-week political protest, and it wasn't about money, and it wasn't about working conditions in 1997. I mean, it's just so it's a serious thing is what I'm saying. And it's important maybe at times. I'm not
I see.
advocating, it's up to.
Okay. I see a bunch of people's hands up,
Yeah.
but if you're okay, I need to get to the action
Yeah.
plan because
We
everyone's
need
been asking all night. So
Yep.
let me just get to
We
that
need
and
to
then
get to
if there's
action
still,
now.
yeah,
That's
I
what
just
we need.
want to give a chance and just, so the conditions of work in hospitals and in long-term care and in home care are the conditions of care for patients. We have a joint interest. You know, Michael talked about how the workers have a duty to defend the service, defend public health care. And we as patients and community members have a duty to protect the workers who provide such a service to us. We are there, Bernie, we're there for you, for the nurses, we're there for the support workers and the RPNs, Michael, Erica, we're there for the health professionals. We see the team, like the whole team, and we understand how much we have, how much you've sacrificed for all of us. I think I can speak for all of us when we say that. And then as patients, we're advocating also for the services. And you know, we're going to be more powerful together. There's going to be a lot that's happening. And so we need to actually really commit that we're not going to, like, it can't be 25 people, you know, out in front of the hospital. That is not going to make a difference here. We're going to need to dig deep, and all the ideas like Mev's and Sammy's and all the ideas about, and Kathy's about how to communicate and how to really get this out. Like, don't wait for us. Produce your own leaflets, right? There's nothing to stop it from happening. The Kingston Health Coalition has all kinds of talent. Produce your own social media content and so on. Like let's all do it and communicate like crazy. You know, I shouldn't use that word, sorry. And get the word out in every possible way and build for this and bring more people on. And everyone has talents and ideas that can be brought to bear here, and they're all needed. Britt is here. She's our staff, our campaigner staff person, and she can share her screen. And I should just say, where is this going? I mean, ultimately, I hope there is job action of some sort, and we'll support, but or a province-wide referendum, right? Like, what could actually stop this? Well, job action could actually stop the privatization, could actually win if there was a series of concrete measures. A referendum where we get 1 million people to vote against the privatization of the hospitals could actually, that would shake any government, you know? And we could do that, for sure we could do that, but we got to build there. And there's some distance to go. And of course, the workforce is working nonstop and under enormous pressure. So we need to do our part as community, and the unions are building. Like, I'm so thrilled with the press conference last week and the 5 unions working together. It's really, really impressive. So thank you, all of you, for your strength and your nonstop solidarity. If you go to our website, so if you Google or whatever your search engine is, Ontario Health Coalition, it's just ontariohealthcoalition.ca. Britt is showing you at the top there, the URL. And then if you scroll down, so there's that slideshow. Sorry, can you go back up a bit? So that's the slideshow. It just changes, the picture changes across the top. Let's go down to defend our public health care. We're trying to sign up 1 million public defenders of public Medicare. And it's that blue box there. You put your first name, your last name in, etc. It's not a membership. Like, we're not asking for money. We're trying to get the numbers. We're trying to, because if we're going to do a province-wide referendum, we need like 1 million people. We're going to need a huge amount of people. And every time someone signs up, the counter goes up. And if you want us to keep in touch, oh, why are we going down? Stop going down. If you put your name and stuff in, you can choose whether or not we keep in touch with you. It's a check mark. So we only will keep in touch with you if you check, but everyone's name is going to, yes, we can put the link in the chat. Everyone's name will count. And as Britt was trying to show you by scrolling down, sorry, Britt, everyone that signs up, it's just a first name. So Selena in Kingston, that was you, signed up, right? Everyone could do it. You could do it right now. Takes 2 seconds. And then what we're asking, what is a public Medicare defender? Well, will you go door to door or distribute leaflets in your workplace or in your seniors organization or your community group or at your university? And if you don't like the leaflet, we can change it up or make another one, or you can. And so if you want to see the leaflet, can you click there for here? Sorry, go up to click here in the box. So it says, these are the 3 things you could do: hand out leaflets, fill in surveys, promote and attend local protests. So for the actual leaflet and so on, click here. There you go, click. Sorry, here we go. So the leaflet is printable, it's there. We'll make sure the Kingston Health Coalition also, and we're just playing with it a little bit, so it'll be graphically different probably tomorrow. But we'll make sure that the Kingston Health Coalition has printed copies if people need printed copies. And, so like Marilyn's idea, it's kind of like a petition, right? Signing up Medicare defenders, it's sort of the same thing. It's just a kind of different packaging. So we're asking, will you go door to door? Will you ask people to sign up to become a public Medicare defender? Can we get 1 million public Medicare defenders? That would shake up any government. If we get 8,000, 10,000 in Kingston, that is huge, right? That makes a big difference. And then from there, we also have a way to communicate with people when we're going to ratchet things up. The surveys are about the question that people had about enforcing the Canada Health Act. The majority of the private clinics violate the Canada Health Act and charge patients thousands of dollars for services or hundreds of dollars for extra add-ons and so on. We need the evidence. We need the stories. I bet you there are people here that have been charged in private clinics for things that they should never have been charged for. So we have a really simple survey. This is particularly good if you're in a seniors organization or community groups where people like, disability groups, quote unquote, or, other organizations where people have, need to access healthcare services a fair amount. It's super simple, the survey, and it just asks, like, have you been charged for something? To ask some demographic info. Have you been charged for something? What was it? What did it like, how much was it? What did they tell you? You had a choice or not? And then, what kind of impact did it have on you? Like, was it a hardship for your budget, etc.? So it's really quick. And the last time we did this, we had about 400 or 500 patients fill them in. People can choose whether to do it anonymously or not. So again, if people want to share their contact info, then we can get a hold of them and do press conferences across the province with patients who've been charged in private clinics. We can file a writ of mandamus, which is a court action to force governments to uphold their own legislation. So federal government uphold the Canada Health Act, provincial government uphold the Canada Health Act and the Commitment to the Future of Medicare Act that forbids such extra billing of patients. If we're to get them to crack down on the private clinics, which would be, both it publicizes what these things are and what a threat they pose, but also, that is their business model. They wouldn't exist without extra billing the patients. And then the last thing is we are holding protests right now across the province. The one, we're not trying to hold one in every town at this point. We're trying to hold several large ones that show some visible resistance. And that's okay. You can stop sharing the screen there, Britt. Thank you very, very much, honey. So we're trying to show the public visible resistance so that they know there's a fight. They know that there's something to join and they understand we can overcome this every time there's a media story about the emergency overload. The government says it's not a crisis, or they say we're hiring 6,000 staff, and that's it. Then they think the issue is put to bed. So the nearest one to you will be December 9th, Friday, December the 9th in Ottawa. outside the Ottawa General and CHEO, which is the Children's Hospital of Eastern Ontario. We're hoping people from Kingston will go there, unless you want to do your own, but we're trying not to like do more than we can handle before the winter break. And so we're trying to make these big. So what we're going to do is go with messages of gratitude and support for the hospital workers and leadership for everything that they're doing. Like, thank you so much for everything you're doing for all of us. And, you know, how dare you, Doug Ford, do nothing in the face of this unprecedented crisis and privatize our hospitals. So it's the combined message. There's a big fence there. We're going to cover the fence with the thank you messages to the hospital leadership and staff, and the you know, damning of Doug Ford for privatizing, for doing nothing. So that's noon Friday, December the 9th in Ottawa. Bernie's going to be there. I hope Michael's going to be there. And we're going to really make it, put real effort into making it huge. Everyone matters in this. Like, don't skip it because like everyone else is going to be there. Everyone matters in this. And the more people don't feel like they're personally responsible, the fewer people will come. And we need to make it big now, right? So those are the immediate things. Love to get your feedback on them. And then we'll send out in a follow-up email to everyone all of like the details and so on about this. So it's easy to follow and easy to do.
Great. Thank you, Natalie. Fabulous. Now, 2 people have their hand up. So if we can go quickly to that, and then let's wrap it up and make the plan. So yes. So Susan, please.
Hi, I think you pretty much, I put it in the chat box. I've been a member of the Registered Nurses Association for very many years and sat on their policy and political action committee. And we have been literally begging for more nursing staff. And in order to have the staff, you have to have the seats opened in the university. I assume it's the same with all the lab things. I mean, you can say we want that, but education and healthcare, and I think that was my earlier thing with CUPE. Perhaps in my mind, there wouldn't be as many children in hospital if in fact CUPE had won the right to have more custodians cleaning the schools. So if you keep the schools clean and you're able to do mass, I know in hospitals, we increase cleaning during these periods, but there was that was part of, I mean, I have no idea how that'll turn out, but part of what they said is that they were happy to get the monetary, from my understanding, but the leader, Laura Walton, was quite disappointed that the staffing wasn't there. When we're seeing that the hospitals are overrun and it's costing far more to put kids on vents than it would be to put a few more custodians into schools. That's where we can't just say, you know, we're healthcare and rah, 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 we're marching. Somehow we've got to connect the dots that we're interrelated, that to put the prevention in our schools might actually cut down on the care in hospitals. So what we're doing is moving to the most expensive level of care when we could have, for a few shekels, had a cheaper one. And furthermore, real quick, you have to open those university seats and fund the university seats to get the staff through.
Okay.
And masks.
So,
like, I mean, to be honest with you, I should say, because the Health Coalition is really trying to get this message out. Our public health officials have failed us. We absolutely are in a crisis like we've never seen. The very least we could do is wear masks in public places at this point, all of us. So please, please, please do. Thank you. Thanks, Susan, for your comment.
Yeah, thank you. Yeah, so 2 things there, but what we need to do is for you to sign up to be a defender, and then we're going to all be together, because we are not all healthcare workers here. There is like community, a lot of community here supporting healthcare. So I want you, if you're a healthcare worker, I want you to know that. Matthew?
Thank you for letting me speak. I'll try and be short, but you know, it's hard for me. I want to say I'm really enthusiastic with the attendance, with the ideas of what to do. I think it's very important to do it. I'll be there from December 9th. I do want to note that some of the ideas that were raised today sounded really valuable to perhaps pursue further as part of the campaign. Specifically, the government's misrepresentation, oh, we can't do anything about it, we're spending money, we're doing everything we can. But there was information given, like the lack of funding more seats for students and issues like that, that if we can document a separate document that says, here's how we solve it. One of the things we need to say in there, and I don't know where we get the information, but it was pointed out that some people do have the information, that a lot of the costs are going for profit. When you privatize, you pay more for less because of the profit. And if we can document that, how much more the private sector is getting for what they're doing and the consequences of that, or the selectivity of their work, I think we need to communicate to the public that we need to address the message of the government and its ideologues as to what really is possible. I don't mean to overstate. I thought that was an important component to add because I'm reflecting, I think, a variety of ideas that were stated at this meeting. I thought they were useful. I hope that helps and it doesn't take too much time, everybody.
No, thank you, Matthew. Once again, good additions and good ways forward to go from here. So
Joan, I forgot something. Sorry,
okay,
Maeve.
please. And we're
Sorry.
okay, just that people are putting their hand up now. We're going to be wrapping up.
we gotta wrap
So
up, yeah.
we'll go Erica and then, okay, we'll go Natalie and then Erica and then Natalie again.
Well, it won't be, well, okay. Just really quickly, Maeve, I didn't want to drop Maeve's input.
No.
Maeve, will you work with the Kingston Health Coalition so we can actually generate more content and some approaches around the social media ideas that you had? And also, like, I think we should do something at the universities when the term starts in January. Like, it would be great if we could do, there used to be these like big anti-globalization movement, like meetings in Kingston, it could be at the JDuck, I don't know, is it open or something like that?
Yeah.
You know, where there would be a good way to sort of get a bunch of students kind of active and moving on this. Anyway, if you would work with us so we can figure it out, that would be amazing. Sorry.
No, that's great. Thank you. Erica, please. Hey, whoops, we can't hear you very well. It's a little tinny. Okay. No, it's screechy. Is there, yeah. Can you get closer to the mic or maybe? Or turn something off?
Or put it in the chat?
Put it in the chat.
Sorry, Erica.
Yeah. So I wanted to hear it, we just couldn't hear it. Sorry, or we heard other things. Okay, so I don't have a keyboard with my computer, sorry about that, but I'll write it down. But if you'd like to contact me at kingstonhealthcoalition@gmail.com, that's here, and I can try to contact with you, or you can contact me. I'll try to get it in the chat, but I'm going to turn it to Natalie, please.
I talked a lot. I just wondered if Michael or Bernie wanted to say anything really quickly, just other than like, just thank you, all of you. And, but any last thoughts to leave everyone with? Sorry, John.
So I really think that these mass rallies will be a wonderful way to let the government know that how much we value public health care and the importance of it in our communities. The nurses and healthcare professionals at both CHEO and the Ottawa General, where the first rally will be, they have been working so hard, as every hospital in Ontario has. So I hope it's a wonderful turnout. I see people who say they're coming, which is really great. It's wonderful that you make that effort. And I just can't believe how many people came tonight to this town hall. It was really well attended. Thank you, everyone, for your questions. And I hope you learned a little bit more about what's happening in Ontario tonight.
That's great. Michael or Drew? Michael?
Drew, go ahead, please.
Sorry, Drew.
Oh, no, yeah, I just want to make sure that we get as many people's experiences with the healthcare system out into the public as well, because it's what actually is going to be the big aspect of the drive to stop privatization. We can't afford to be paying for things that are not available to us, and that is something that the only way we're going to get through that is by sharing patient stories and getting patients involved in sharing their stories on what they have been through, what they have done. So if you know anyone that has a experience with healthcare, encourage them to get involved with the campaigns and let them know what the public has faced with. Thank you, everyone.
Thanks, Drew. Michael?
And just to underline Bernie's comments, thank you so much. Wonderful turnout, great discussion. And if we could make the December Ottawa protest a focus and make that a huge success, I think that's a great starting point.
Excellent. Thank you very much. So what we need you to do is sign up to be a healthcare defender. Thank you so much for coming here. And thank you to the fabulous Ontario Health Coalition for the work. They're a small group, small office, but many tentacles and get us motivated. Thank you very much to the speakers. You are all fabulous, and we learned a lot from you. And we even to show us how dire it is, but you each gave us hope for the future. So please sign up to be a defender. We will be in contact. Our next meeting of the Kingston Health Coalition is January 18th, but I hope to see you in Ottawa on the 9th, and we'll try to be in contact about maybe we can assist people getting. Okay, so with that, if I'm going to look to Natalie one more time, I think that we are finished. And thank you so much for coming and caring about public health care.
Joan, excellent job. Thank you. Thanks, everybody.
Thank you all.
Nice to see you. I'll see you in Ottawa on the 9th.
Yes.
Oh.
Great. Thanks.
Bye.
Okay, bye.
Thanks, Drew. Sorry for skipping you.
No, you didn't. Yes.
Oh, now before we leave, Britt, will you make sure you got the chat? I don't want to leave without having it because I didn't get a chance to read it all.
Right. Lots of good ideas in the chat. So yes, I wanted to make sure. I was kind of staying along to make sure we had the chat and that.
Yeah.
Okay. Thank you. Yeah, I'm just trying to save it. It's a little bit different since I wasn't the initial.
Okay, just 1 sec. Let me see.
Actually, Natalie's the host. She might be able to.
I just saved it.
Okay. Excellent. Thank you.
Yay. Sorry.
Thank you all. See you around. We'll be in touch.
Thanks, everyone.
Okay,
we're all so together on it. Okay.
And you can end the recording.
Thank you all. Okay, I'm leaving.